as to how to view your work and how to make your choices. And it is much richer in the breadth and depth that it allows you to evaluate your circumstances.
Mission-based decision-making is really the intentional application of our mission and values to any decision, whether it has to do with hospice care or home care or a new service line in an acute care setting, expanding into a new market, developing a palliative care program. Whatever the venue, whatever the initiative, we want to be able to apply our mission and values to it in a very intentional and explicit way.
Mission-based decision-making is both a managerial practice and a competency. It's a part of our culture and is integral to how we do business. Very often, mission-based decision-making isn't easy. We have to balance many variables. We need to be responsive to business and clinical demands and to the expectations of accrediting agencies and payors. But most importantly, we need to meet the needs of our patients, families, and residents, as well as associates and physicians who practice in our facilities.
We ask management to make the right decisions for the short and the long term, and of course the mission speaks to improving the health of communities. So our leaders have to have enough vision to look into what the future consequences are.
I have seen what happens when you don't follow a mission. It's very easy to stray. By the way, straying is expensive. When you do things and you have no real guidance, it costs more because you're doing more. And you don't know who's doing what most often. So I learned early on that the way to accomplish most of what seems to be a piece of a strategic plan is to head the plan with a very clear, very succinct mission.
Mission-based decision-making influences a limitless range of issues and topics. Some of these issues could include whether to add or discontinue a department or service, what our position should be on public advocacy, what our associates' benefit plan should include, if, when, and how to implement a reduction in staffing, rationale for capital investments, or taking the initiative to change a clinical process to better care for our patients, families, and residents.
When we talk about the mission of the organization and the core values, it's very easy to become focused exclusively on men and women who are engaged in direct caregiving. Their work is supported by an enormous cadre of people who, for want of a better term, work backstage. They are the people who do the business planning. They're the people who grind the numbers in finance. They're the people who monitor our human resources. They are the people in our supply chain. And there's probably other groups of people I should list as well. We need to continue to enable these groups of people to be able to identify with the mission. On a day-to-day basis, they can become so focused on getting the job done, of getting the numbers out, of getting the policy done, of getting the orders placed, of tracking supplies, that they forget or they are not given the opportunity to see that those numbers track to people's and those supplies go to provide care for the poor, the indigent, and the people who are very, very vulnerable. We need to enable all of our associates to see that each one of them is an essential link in driving that mission of the organization.
Within Mercy Health Partners right now, we're looking at building a new hospital in a particular area of the region. It's not a cut and dry decision. Money, no money, combined money, increased revenues here, a good physician base. Those are all pieces of the decision that one would make. But at the very focus, the very center point of this has been the community. We are a system. Catholic Healthcare Partners is a system, by and large, of community health organizations. So to make a decision about something as large as building a new hospital without thinking about the community would be ludicrous. So that community is right in the center of the decisions that we're trying to make, and we're not trying to make those decisions alone.